Hey, it's Bo for the City of Eureka and the Eureka Chamber of Commerce, and we are today right down from Walmart at Eureka Town Center, Axis Physical Therapy. Let's go on in and see what they have to offer for you and getting you back to health or maybe get you stronger. That's what they do here at Axis Physical Therapy. Let's go. This is Lauren Huckstep, and she is the clinical director here at Axis Physical Therapy. How are you?
I'm doing great.
Congratulations, 1 year.
Yes,
That's
1
huge.
year.
And
So
people
excited.
are discovering you, right?
Yes. We've had some good organic growth, I'd say, over the first year, and we just hired on our third therapist, so we're a 3-woman crew right now. So lots of techs and a front office supervisor. So
who mostly comes to find you, or do they need to be prescribed by a doctor to come see you?
yes, they do.
Okay.
Yes,
okay.
they do. Our prescription by primary care or a doctor of chiropractic or orthopedic. We treat all sorts of musculoskeletal injuries. And all ages, really.
Muscle, ligaments, all that stuff?
Yes.
You're like getting them stronger, that kind of thing?
Yes, rehabbing from any type of injury that they might have. Could be overuse injuries too.
Oh boy.
Repetitive injuries. I treat a lot of runners. So.
Oh, do you really?
Yeah.
Okay.
But a lot of total knee replacements too, and rotator cuff repairs and stuff like that. So anything orthopedic and sports medicine based.
You have to do what they say to get you stronger and get you better and
It's
get you
the
back
truth.
to, it's true. Because somebody that has a bad hip is going to favor one side or the other,
Yes.
and that could get them in trouble too, right?
Right, correct. Yes, we're looking for symmetry as much as we can gain. We start from the ground up with our injuries. It can be table-based at first, and then you're standing, and then we're adding load to get those ligaments, tendons, muscle stronger, those joints more stable. So it's definitely progressive over time, and we've got lots of ways to get creative in here, depending on what the injury is and what your goals are.
So when you see a new client come
Yeah.
in, a new patient, I guess
Yes.
you call them, and they are hurting bad.
Yeah.
You've seen the beginning to the end of their journey with you, and I
You
bet
got it.
that's got to be fulfilling, right?
Yes, absolutely. When we see a patient go from not being able to walk or get in and out of their home or back to work, and then we get them back to work, and then we also get them back to taking care of their kids or their recreational activities, goals, hobbies, stuff like that. That's what we want to see, and we want to see that sustainability long term. This is where patients are going to spend a lot of their time. A lot of times we'll start them on the table, we'll start working on them, stretching them out, doing joint mobilizations. We might do some soft tissue work, something like that, just to really establish the rapport with the patient, talk to them about how they're feeling that day. And then, after we do a few exercises on the table, then we're progressing to standing, and then we're headed over to the weight stack or the leg press or using weights or using our bands over there to kind of bring things full circle. Some of our patients that would use this, maybe they're getting back to just being able to navigate an incline or navigate a decline or be able to navigate their stairs in their home, up or down. We want to see this with our patients that are maybe a fall risk and need to still be ambulatory in the community. So we like to incorporate this in their care to make sure that they feel solid and safe. We'll also do this with industrial rehab. A lot of the times our patients need to be on their feet for a long period of time, and they're up and down, inclines, declines, steps, lifting things, putting things away, and they are on their feet all day. So this is a good way to rehab from an injury and also train so they're ready to go back to work. So a lot of the times we'll get athletes that have some sort of endurance component, whether it's running or they just have to return to run in general. Maybe they're not just runners, but they have to return to running the bases, they have to return to running sprints on the field, plant change of direction, stuff like that. Well, we want to make sure that their running gait is sound. So after they're recovering from any type of injury, it could be a simple muscle strain. And if they're trying to get back into running, we do a running gait analysis, and we do it indoor, and we also do it outdoor. So this is one of the components to our running gait analysis. So we're going to put a patient's video up on the TV and kind of talk about it. We're going to slow it down and break it down like piece by piece. We have like a slow-mo component, so we can kind of highlight foot strike, mid-stance, toe off, and kind of break that down for the athlete and determine maybe where they are mechanically breaking down, and then how we can strengthen the runner, work on mechanics, work on coaching cues to get them a bit more sound so we can get them back out pounding the pavement. Now you can see the sleeves that are on this particular runner's shins. That's our like software technology that we put on the runner and their sensors, and they're going to pick up ground reaction forces, IPA, cadence, stuff like that. That's really nerdy and geeky, but we love it as PTs, and it really helps us get a full understanding of the runner and how to help them rehab their injury. So there's your posterior view, just to kind of get an idea. And we'll even like scan up on the patient too and look at lumbar spine and the hips too, and slow it down frame by frame and kind of just get a good grasp what's going on.
Explain what I'm looking at here.
So this would be the breakdown of the running gait analysis. So this is going to be how symmetrical the runner is from right to left. This is going to capture ground reaction forces, how fast their foot is hitting the ground. It's going to pick up their turnover rate. And then from there, I mean, if they're coming off an injury, we're seeing big differences here. This particular patient's pretty symmetrical, but this was towards the end of her rehab. She was ready for discharge. So, and she's back out there running now. So, but it's really nice to have this data to really take care of our people from start to finish.
All right, this is Bruce Watson, one of the owners of Axes Physical Therapy. I always want to know the genesis of the name. Where'd you come up with that?
Yeah, Axes, plural for axis, and actually are 3 axes: patients, clients, and employees.
Love it.
And they come together at a center point. So if you look at our logo, you can see the 3 axes coming together at a center point, and that's
very cool. Okay.
Place of great importance to an activity
See,
or interest.
now I can sleep tonight.
There you go.
Now you know, right? Bruce, how long has Axes been around?
We've been in business since 2016.
Oh, wow.
Yeah, so a little over 7 years.
And built quickly. You got a lot of locations in there.
Yes, sir. We have 18 locations in the greater St. Louis area.
What got you involved with doing this on your own?
Yeah, just wanting to get back to the roots of why we wanted to become physical therapists in the first place, which is really get the focus of the business back on our patients and our clients' needs, as well as surrounding ourselves with a great team of therapists that are passionate about what they do. Yeah. So we've all been through sort of the large corporations, and it was really about getting back down to the roots of why we do what we do.
And you're doing it right. Good stuff. Do you have a need for employees? And where can we send them to get information?
Yeah, so absolutely. We're always recruiting, always looking for good people,
good.
Passionate people that want to make a difference in people's lives. So you can, people can go to our website. We have a careers page on our website where they can go and look for open positions. Those positions may be the professional positions like physical therapists and occupational therapists, or it might be our front office staff, clinical technicians that work in a clinic. And it's all about people that are excited to be a part of a team and want to be part of a great culture.
And locally owned too.
Locally owned,
that's
yes, sir.
That's a big deal.
Yes, sir.
All right, Bruce, nice to meet you.
Nice
Congratulations on 1 year in this location in Eureka, and on to location 19 and 20 and beyond.
Absolutely.
Good stuff. Nice to meet you,
Thank
sir.
you.